you mentioned about the percentage of psychological addiction in long-term chronic pain patients who've had no previous history of substance abuse or trauma in their life. What do you sort of, how do you assess that?
It's a really, really complex question, because many of the things which predispose to addiction, such as early life trauma and painful things happening early in life, experiences of abandonment, neglect, and so forth, those things also predispose to addiction and chronic pain, because they're both managed by overlapping areas within the nervous system. So it's also the case that these people with vulnerable nervous systems, there's a genetic contribution to it as well. The propensity for addiction runs in families. So in many respects, the number of people with addiction problems and chronic pain is not that much higher than what you would expect. And I'm not sure that the exposure to potentially addicting drugs like opioids accounts for the increased rates of addiction that we see. I think it's more likely the other explanations. Now, having said that, there are a lot of my patients who are unfamiliar to someone like an addiction medicine specialist, for example, and we call them, good opioid citizens. They're people who are on a modest dose, who get good results from it, who don't seem, although we keep monitoring them for side effects and long-term harms, they don't seem to develop them. And, they continue to turn up on time to get their scripts. Occasionally something will happen, the dog will eat the script or something, and you've got to do it. But these are people who are reliable and who, if you suddenly took them off the opioids, they're going to get withdrawal because they're physically dependent, but they're not addicted. And that's a group of patients that are very unfamiliar to people who work in the addiction space, obviously, because they're used to having patients who don't accurately report their substance use. So I think a lot of our policy has been driven by the addiction fears, not so much by the fact that this is a vulnerable group of patients anyway, because the same things that predispose to addiction tend to predispose to chronic pain as well. And that I think it's still possible to use opioids safely. And that said, with opioids as well, we are much more aware of the risks of them than we used to be. And so what we consider a reasonable dose has come down a lot in the last 15 or 20 years.